And today is World Diabetes Day, with access to diabetes education as its focus. Now, in advocating this cause, stakeholders from an organization in Lagos State are pushing for better care and education for diabetic patients. Inioluwa Kwobola has the reports.
About 537 million adults globally are currently living with diabetes, and this number is expected to rise to 643 million by 2030. Some stakeholders in shedding more light on diabetes say lack of awareness and proper treatment is raising the number of cases.
When we see someone has diabetes, what we actually mean is that the person's body is not able to deal with the sugar that the body generates from the food that person has eaten. 50% of those people who have it don't even know that they have. And that's why we encourage that when patients come to the hospital, no matter what they come to complain about, when they are running their test, blood sugar check should be part of it.
Apart from diagnosis, the healthcare practitioner needs to have access to education on how to manage the patient, how to instruct the patient, how to even pass information across to the patient. And also, for children, because I'm a pediatrician, I'm very particular because children have a long way to go. If they are not diagnosed on time, their tomorrow is done for.
According to the United Nations, diabetes is a major cause of blindness, kidney failure, heart attack, stroke, and lower limb amputation. For these stakeholders, it becomes relevant to take this information to the grassroots.
Everybody needs to know, because from the numbers, more than half of people who have diabetes don't even know. So it means that the general public also has to know. So they'll be able to know when the members of their family are showing symptoms, and even they themselves, when to go for checkups.
Drive this further by taking these messages to schools, taking it to churches where people are gathered and where we can provide this information. Not just school, churches, mosques.
As the cases continue to rise, these stakeholders say it is necessary to constantly check one's health status to avoid late detection. Inioluwa Kwobola, TVC News, Lagos.
Now, for more on the World Diabetes Day, clinical pharmacist from the Lagos State University Teaching Hospital, Ikeja, Dr. Modukbe Oyawole, joins me now on the news. Good to have you join us.
Thank you very much. Thank you for having me.
If you followed that, you were listening to that report as I was, and one of the things that, the speakers that kept repeating was that half of those who have the disease don't even know they have it. And one wonders why that is. What are the symptoms to watch out for? And then again, they mentioned something about sugar test. How effective is that in detecting diabetes?
Thank you very much. Yes, quite a lot of people that have it don't know, because it is not a disease that would usually show up almost immediately. And what usually happens is that sometimes it's symptoms over time. Some people, they start losing weight. Some, it's just because of symptoms like frequent urination, which we call polyuria, especially in the night. They have to wake up often in the night to do that. Then tests, which is polyphagia. The person starts feeling like they are always thirsty. They need to drink a lot of water. Then also some of them it's even when complications sets in that they will now need to do the screen before they now found out that they have diabetes. And that's why one of the consultants also said that it's now routine, even in the hospital now, for almost everything that really presents with, because it's a chronic disease. And because it's chronic, it means that it's a disease that you cannot cure, but thank God it can definitely be managed. But early detection goes a long way before the complications start setting.
I was asking them how effective the blood sugar test, because again, one of the things that you have to do that regularly.
Yes.
How effective is that?
Yes, it's very effective, because there are lots of equipment, we usually call it glucometer, that can be used to do it. Then we also have the one we call the HbA1c. That one can even detect if a patient is not controlled over a period. It's just that is done like once in 3 months. But the one of every day, it goes a long way in detecting, because you quickly detect who the person is, especially when it's consistent like that and it's high there. Because when it comes to blood glucose, what we're trying to say is that, just like I mentioned, that anytime anybody eats, if the person is diabetic, instead of the normal person that will eat and then you use it up, it goes to glucose, then you use it up as energy. But for them, what happens is that the insulin that is supposed to take care of that is not, it's either it's produced but it's not effective, or they don't have it at all. So in that case, what you find is you find it accumulating in the blood. And when it accumulates in the blood, that's what is detected using the glucometer. So that can definitely be detected. Once you have the right glucometer, you get it often. And once you detect it, there's also what we call 2 hours postpartum. That's after meal. So it's not just one-off testing. There's one of before food, and then there is one of after food.
I mean, there are
so
lots of questions running in my head because of how important this is. I saw the figure there. About over 500 million people in the world are now living with it. Yes. And then also by 2030, you have more people living with it. And I've seen a lot of celebrities who are saying, look, they are living with it. And so, but they have been managing it. But I want to ask you, in terms of prevention, because again, they will always say prevention is better than cure. I mean, it's general stuff we say here. How do we prevent it? And then talk to us about access to care as well, which seems to be the theme for this, for the next, I think this year and next year as well.
Yes, access to care and diabetic education. That is what the theme is about. Okay, so what usually happens is that because, like you have mentioned, it's a disease that quite a lot of people have it. So when you're talking about access to care just means that the patient has to go to the hospital once. But the good thing is that for Lagos State, for example, we have a lot of hospitals now, even in the private hospitals. Once it's detected, there are drugs are readily available, and for the management, the patients just have to be part of it. And once you're part of it, you detect it on your own, you monitor on your own, and then you are able to take informed decisions. And that's why the emphasis on education. Because when you educate somebody, you empower the person. And when the person is empowered, the person knows that this is what I'm supposed to do to make sure that I don't have it, to make sure that as I have it, it's controlled. Then when it talks about prevention usually, our diet has gone a long way to especially influence the type 2, because there are quite a lot of time, but the 2 common ones are type 1 and type 2. Type 1 is usually what we call autoimmune, meaning that it's just starts on its own, or maybe because somebody in the family has it, and usually detected in the younger adults. But type 2 most times has to do with the lifestyle. So prevention is to eat right, to exercise, improve your lifestyle, no sedentary lifestyle, and then make sure that you check often. Any screening method that you're around, anytime there is any opportunity of screening, you get involved in it.
All right, thank you so much for the information. I'm sure people are listening and would do the right thing, especially information you have given. Thank you so much for talking to us. Clinical pharmacist from the Lagos State University Teaching Hospital, Ikeja, Dr.
The chairman of Association of Hospital and Administrative Pharmacists.
All right, Dr. Modukbo Yawoli, thank you.
Thank you very much for having me.